Hi everyone, my name is Vanessa Rodriguez, and I will be talking today about a collection of topics related to social skills. This is specifically pertaining to children diagnosed with autism spectrum disorder. First, we're going to go ahead and take a look at autism spectrum disorder and what it entails. Autism spectrum disorder, also known as ASD, is a neurodevelopmental disorder that causes severe and pervasive impairments to the individual diagnosed. ASD has been characterized by challenging behaviors that can affect the individual in various ways, such as the abilities for the individual to effectively communicate and socially interact with others in their own natural environment. ASD leads to impairments in different areas as well, such as socialization, communication, and also oftentimes leads to restrictive, stereotypy, and restricted patterns of behaviors. Some of the characteristics found within the disorder of ASD is shown in the individual experiencing different skill deficits and delays, such as delays in peer interactions and communication with others, delays and deficits in verbal language, delays in social imitative play, and delays and restrictions with repetitive motor and vocal behaviors that all interfere with the ability for the individual to function appropriately in their own environment and amongst others. These delays and skill deficits tremendously impact the ability for the individual to socialize in their environment, such as in the school and community events, and it also makes it difficult for them to create positive relationships with their peers, family members, and individuals in general in their environment. As the number of individuals diagnosed with ASD continues to increase, a vast amount of research has been conducted to evaluate and investigate the strategies and interventions that can promote these social skill deficits and help the individuals function appropriately in their environment and amongst others. Specifically, applied behavior analysis, also known as ABA, has been one of the fundamental behavioral sciences approach that has placed focus on the experimental study of significant social behaviors and its function with environmental variables. The research on procedures developed by applied behavior analysis has had a significant impact on reducing severe problem behaviors as well as enhancing and maintaining verbal, intellectual, and social functioning skills in individuals, especially with ASD. These interventions and procedures that are used to treat children with this diagnosis all stem from evidence based practice and research supporting the effectiveness of such strategies and the effectiveness in treating, modifying, teaching, and shaping such behaviors. Evidence based practice is a fundamental problem solving approach that incorporates the best evidence driven through clinical expertise and experts highly trained and professional with professional experiences, as well as evidence collected from scientific literature, observations, and data collection, and lastly, through client, caregivers, and patient perspectives in personal and cultural values. Driven through the study of applied behavior analysis and evidence based practice, behavior analysts have been able to use effective interventions and procedures to target social skill deficits experienced by these children with the diagnosis of ASD. As mentioned earlier, social skills are vital to the individual's overall ability to function in their environment, appropriately interact with others, and gain access to their own wants and needs, as well as communicate effectively in the community. Social skills, such as being able to engage in conversation, appropriately engage in social interactions, or play activities with peers, express one's emotions appropriately, as well as understand the feelings of others, are all essential skills to teach and shape in a child's skill repertoire. These social skills are specifically important in settings such as the school environment, community events, and family gatherings. To continue, there are many social behavior challenges we may encounter when working with an individual diagnosed with ASD. For example, we may observe social behavior challenges such as engaging in self-stimulatory behaviors, engaging in vocal stereotypy, engaging in physical or verbal aggression, making inappropriate comments during conversation, difficulties in initiating conversation and/or remaining on topic during conversation, difficulties making eye contact when speaking, difficulties engaging in turn-taking activities, and difficulties engaging in imaginary play with others. There are many effective interventions used in ABA that can target increasing and/or teaching social skills, as well as decreasing inappropriate social behaviors an individual may be engaging in. For example, behavioral skills training, also known as BST, have demonstrated through research studies to be effective in teaching social skills, such as increasing appropriate vocal communication and engaging and/or maintaining conversations with others. Research studies have also been conducted to investigate the effectiveness of BST teaching protocols and found it to be very effective in teaching children with disabilities and a variety of skills, such as teaching children safety skills in the community and self-protective skills to use in social settings. Another useful procedure to use to target social skills is the Program for Education and Enrichment of Relational Skills, also known as PEERS. Research has supported the effectiveness of this intervention in teaching social skills, as well as addressing challenging behaviors individuals may experience, which are related closely to understanding empathy, loneliness, and social anxiety in these social settings. In addition, research support provided evidence support on the intervention involving ABA-based curriculum protocols and assessments. Studies have shown this protocol and assessment method to be successful in teaching language skills to children diagnosed with ASD that are needed in order to build different relationships in their own environment. As we continue to explore the interventions and procedures that have shown to be promising in teaching these social skills, we must also consider interventions that will be feasible for caregivers and/or other individuals in the child's environment to implement. For instance, many times teachers may experience challenging behaviors in their classroom setting, and it is important that we, as behavior analysts, can provide them an intervention that can be easily and accurately implemented in the school or classroom setting, considering the numerous children they have to attend to. Functional communication training is one of these interventions that can be easily implemented in such settings and can be easily taught to the teachers, staff, and/or caregivers. This procedure allows the individual to prompt the child's functional communication responses and more appropriate ways to communicate, which will then subsequently help decrease the inappropriate behavior the child may be engaging in order to access these reinforcers. Antecedent strategies are also effective strategies to use with caregivers and teachers, in which they can feasibly alter their environment at home or the environment in the classroom setting in a way that will enhance opportunities for the child to engage in appropriate responses, as well as decrease the chances of the child engaging in maladaptive behaviors. Lastly, group contingencies is also a successful strategy to use, especially in the school setting that allows the teacher to hold access to reinforcers and place them dependent on specific contingencies, such as independent group contingencies, where the reward is based on the specific student's independent behavior, dependent group contingencies, in which the rewards are provided dependent on the behavior of the student or a subgroup, and interdependent group contingency, in which the teacher can provide the rewards based on the behavior of all the students as a whole. These can be different strategies that both teachers, caregivers, or staff can easily implement and continue to take data accurately on. Similar to what was discussed in the previous slide, we must keep in mind that not all interventions may be feasible or appropriate to implement in various settings and/or across various individuals. For example, teachers may have a hard time implementing a procedure that is time-consuming or requires frequent direct observations or data collection. This can also occur among caregivers who may not have a time to allocate into implementing these extensive procedures and also may not have enough time to take data collection. We must also consider cultural barriers, such as the client's family cultural differences and cultural practices that may interfere with the intervention we wish to use. It is important to discuss with the caregivers and families what ABA based interventions they feel are best suitable for their home setting, as well as discussing what behaviors they feel comfortable targeting. It's essential for us to discuss with the caregivers these behaviors that they wish to target and which behaviors they culturally find acceptable. Although we may have a set of behaviors we typically target, such as increasing appropriate eye contact when engaging in conversation, that family may find eye contact to be disrespectful in their own culture. For these reasons, it's important that we discuss these barriers with our caregivers as well as teachers, staff, to make sure that we're implementing procedures that are feasible and appropriate for such settings. As we conclude this presentation, I would like to emphasize on how crucial teaching and shaping social skills is for individuals with a developmental disorder, such as autism spectrum disorder. Social skills are imperative in the overall ability for the individual to socialize among others in their environment, appropriately access their needs and wants in the community and their own home environment, and appropriately interact and build lasting relationships with their peers and loved ones. Thank you again for joining and hearing this presentation.